Hello, my name is Nicholas Rao. I'm a resident here in the general surgery program at Ascension St. John Hospital. I've put together this video to tell you a little bit about the different services that we rotate on as residents here, as well as to give you a brief virtual tour of some of the facilities around the hospital. The acute care surgery service functions as the staff general surgery service. Staff consults are seen and managed by the resident team with oversight from attending surgeons. This service allows for greater autonomy for the chief resident in preparation for independent practice. ACS manages a wide variety of surgical pathology with acute surgical problems including incarcerated hernias, small bowel obstructions, acute cholecystitis, and acute appendicitis, among others. ACS covers the staff surgery clinic each week with the chief resident guiding management decisions with oversight of an attending. Our program director, Dr. Diane, will now share a few words regarding the acute care surgery service.
The acute care service was created this year to improve patient throughput, implement new patient care protocols, and provide for chief resident autonomy. Some protocols implemented this year were gastrographin challenge for small bowel obstruction and laparoscopic common bile duct exploration for common bile duct stones. It is a chief resident on service with the chief resident making all clinical decisions. It is expected to mimic what a chief resident on graduation will see as a practicing general surgery attending, and it's meant to prepare a chief resident for practice.
Service 1 provides a broad-based general surgery experience with multiple attending surgeons offering different perspectives on management of common pathologies. Service 1 also includes management of patients on the colorectal surgery service, who are treated for both benign and malignant disease. Residents on Service 1 provide coverage of both elective and outpatient surgeries, as well as private consultations. Dr. Taylor will now speak about the residency program and the resident experience on Service 1.
Feeling is that this is a great residency. There are no fellowships, and so if a resident has a special interest in doing anything, whether it be plastics, cardiothoracic, vascular, surgical oncology, they can get a tremendous experience and hopefully prepare themselves for a fellowship in whatever field they would like to do. I believe the attendings give a lot of autonomy to the residents. The service is busy. A great amount of pathology is seen here. You're in the OR from day one till the day you leave. If you want to be, this residency really has the opportunity to allow you to do whatever you want to the extent that you would like to do it. Since I've been here, I've always felt that this was a fantastic place to work and to learn. You can make it as academic as you want or structure it to be more non-academic and a more of a community practice for your future.
Service 2 focuses on minimally invasive surgery with extensive exposure to laparoscopic and robotic surgery. There is a focus on hernia management and bariatrics in addition to common surgical pathologies. Residents on Service 2 provide coverage of both elective and outpatient surgeries, as well as private consultations and long-term management of complex surgical patients. Dr. McGee will now provide further information about the resident experience on Service 2.
Service 2 is our minimally invasive and robotic service. Purpose of this service is for the residents to learn both minimally invasive surgical techniques as well as robotic surgery. They have a lot of experience on the console, in the simulation lab, among other things.
Service 3 is our surgical oncology and hepatobiliary service. There is a focus on management of intra-abdominal malignancies with metastatic disease to the peritoneum, treated with cytoreductive surgery and hyperthermic intraperitoneal chemotherapy, also known as HIPEC. These operations provide outstanding exposure to open surgical techniques. Ascension St. John's HIPEC program is one of the highest volume programs in the country. Common malignancies of the biliary system, foregut, and pancreas are also encountered. Dr. Berry will now share further information about the surgical oncology program at Ascension St. John Hospital.
The Hello, my name is Richard Berry. I'm a surgical oncologist, and our Service 3 here within the General Surgery Department is a complex surgical oncology service. We see all types of GI cancers, including liver, pancreas, colorectal, gastric, small bowel, sarcoma. We do advanced gastrectomies, both subtotal and total gastrectomies. We do advanced pancreatic surgery, including laparoscopic and robotic distal pancreatectomies, as well as open Whipple procedures. We are a high volume pancreas cancer surgery program with excellent outcomes that are published. We also do complex liver resections. Myself and my partner, Dr. Choke, does complex liver resections, including open and laparoscopic and robotic liver resections. We also treat and manage a high volume of patients with peritoneal cancer, or cancers that have spread from the colon, small bowel, appendix, ovary, or stomach within the peritoneum. We are the highest volume appendix cancer surgery center in the state of Michigan, and one of the top appendix cancer surgery centers using heated intraperitoneal chemotherapy in the United States. We also have started and developed a interthoracic chemotherapy administration protocol for patients with tumors such as metastatic ovarian cancer or mesothelioma. We also take care of large retroperitoneal sarcomas and other intra-abdominal sarcomas, and include resections of those, as well as really any gastrointestinal tumor, including gastrointestinal stromal tumors. We have a multidisciplinary team that the residents all participate in. All of the surgeries and diseases I just mentioned, all the residents on the service also participate in managing those patients. They participate in the operating room, and they also then participate post-operatively. We have an extensive research arm within the section of surgical oncology that I lead, and there are many opportunities for interested residents to do both prospective and retrospective research with us within our division. In addition to that, we also have a multidisciplinary team that includes fellows within medical oncology, radiation oncology, and other disease site experts. And you as a resident will be fortunate enough to participate in those as well at certain times. So that's a brief overview of the service, and we provide a comprehensive, really overall care for patients with advanced abdominal cancers. Thank you.
Our vascular surgery service provides extensive exposure to both open and endovascular management of vascular disease. Senior residents benefit from a fellowship-level experience with high volume and complex cases. Our hybrid operating room and multiple interventional radiology suites offer excellent facilities for all aspects of vascular surgery. Graduates from our program have historically enjoyed a high fellowship match rate to a variety of different programs. Dr. Huelu will now provide information about the resident experience on the vascular surgery service.
Hi, I'm Dr. Huelu. I'm one of the vascular surgeons out of the group that we have here at St. John, and this is to give you a little brief of what the program is. We do from complex open to very complex endovascular interventions to just the bread and butter from vascular surgery. The residents pretty much run the show, so the chief resident gets to make most of the decisions. They're very, very, very involved in the operations, and they get to do most of the intervention on many cases, from the simple ones to the very complex ones. And this is one of our units here in interventional radiology that we do a lot of our work done here. And if you guys have any further questions, we're always happy to answer. Thank you.
Ascension St. John Hospital is a busy, ACS-verified Level 1 adult and pediatric Level 2 trauma center located on the east side of Detroit. The penetrating trauma rate seen by our team is significantly higher than most other programs at approximately 35%. This provides for a heavy operative trauma experience with hands-on management of critical patients. We work closely with the emergency medicine staff to care for a wide variety of trauma patients. Because of the high volume of trauma patients cared for at Ascension St. John, 24-hour mid-level coverage is provided 5 days a week by a team of trauma nurse practitioners. Given our verification as an ACS Level 1 trauma center, there are a number of research opportunities available involving trauma and critical care. The surgical ICU experience at Ascension St. John is high volume and involves management of critical trauma and general surgery patients, as well as management of a number of patients from surgical subspecialties. We work closely with a knowledgeable nursing staff and a group of fellowship-trained surgical critical care attendings that provide a variety of perspectives on ICU management of surgical patients. There is early autonomy for management of surgical ICU patients, with ICU call beginning during the second year of residency. Dr. Buck, the Director of Trauma and Critical Care at Ascension St. John Hospital, will now share some insight on the resident experience on the trauma and surgical ICU services.
Good morning. My name is Dr. Joseph Buck, and I'm the Director of Trauma and Surgical Critical Care here at Ascension St. John Hospital. The trauma service at St. John is very busy. We are a verified ACS Level 1 adult trauma center and verified ACS Level 2 pediatric trauma center. We see over 2,700 patients annually with 1,800 admissions. So the service is a very busy service, seeing all types of trauma. The SICU service is also very busy. We consult on patients from neurosurgery, orthopedic surgery, urology, ENT, OBGYN, oral maxillofacial, and of course all the trauma patients. It's a great educational experience. I think you'll be well suited to take care of your patients after you complete the residency program with a good background in critical care. And of course, you'll be perfectly trained to take trauma call at any institution you join in the future. We anticipate that in the near future we will have a critical care fellowship and look forward to that. Thank you.
Our breast surgery experience is highly operative, with a number of experienced breast surgeons managing both malignant and benign disease. Residents also benefit from participation in high-volume outpatient clinics. Transplant surgery at Ascension St. John focuses on the outpatient and surgical management of renal transplant patients. Transplant surgeries typically occur once per week. The remainder of the rotation involves time in clinic, managing patients pre- and post-operatively. Residents also benefit from experience with organ procurement operations coordinated by Michigan's Gift of Life organ donation program. Dr. Granger, the Director of the Transplant Specialty Center at Ascension St. John Hospital, will now speak about the resident experience on the transplant surgery service.
Hi, I'm Dr. Darla Granger. I'm Director of Transplant here at St. John. While the residents rotate on the transplant service, they can expect to do much of the work on a kidney transplant. We also, because of COVID, we've had to make changes in our immunosuppression protocols, using more basiliximab, less thymoglobulin, but you get to have a lot of direct contact with the attendings because we're a small program, but you get to do a lot with it.
Pediatric surgery at Ascension St. John Hospital involves both inpatient and outpatient management of a wide variety of pathologies. The neonatal intensive care unit and high-risk obstetric programs at Ascension St. John provide opportunities for early management of complex pediatric surgery patients. Our residents gain experience with the operative management of gastroschisis, omphalocele, and pyloric stenosis, among other pathologies. Our pediatric surgery service is covered by attending surgeons from the University of Michigan 1 week per month. During residency at Ascension St. John, we rotate on a number of elective services, including endoscopy, ambulatory surgery and robotics, plastic surgery, hand surgery, and thoracic surgery. These rotations provide exposure to specialties and operations that are not as frequently encountered during the normal course of residency. Elective rotations are also flexible and can be designed around specific goals or plans for post-residency practice or fellowship training. Current residents have scheduled rotations focusing on endovascular surgery, as well as an external rotation in northern Michigan for exposure to rural surgery. An external rotation in Traverse City, Michigan was recently added to the rotation schedule for PGY3 residents. Residents on this rotation have enjoyed a high-volume operative experience in a setting outside of St. John Hospital, with residents logging well over 50 operative cases in the course of a month. Residents work with a number of experienced surgeons at Munson Medical Center, including graduates of the General Surgery Residency program here at Ascension St. John. The positioning of Traverse City on the coast of Lake Michigan is also a highlight of the rotation. To wrap up this video, I'd like to show you some images from around the hospital to give you an idea of where we spend a lot of our time during the day. This is our main workroom in Suite 212, which is the General Surgery Department office. We will typically meet here in the morning for morning sign-out and spend time here throughout the day working on notes, running the list, and just hanging out. This is our conference room in Suite 212. It gives us a little bit extra space to spread out during the day to work on different things. It's also where we will do afternoon sign-out before call starts in the evenings. This is our main lecture hall where we will have Thursday morning lectures and conferences, including grand rounds and our morbidity and mortality meetings, in addition to near-miss conference. We also have some smaller classroom spaces that are available to us for lectures that occur on other mornings throughout the week. This is a picture of one simulation lab or space that's available to us at Ascension St. John Hospital. We use this space to work on a number of different things, including suture lab, which you can see a picture of us here doing a vascular anastomosis lab using cadaveric vein to work on our suturing techniques. We also have a robotic simulator on site in our simulation lab that allows us to practice different robotic surgical techniques, as well as an endoscopic trainer, which is helpful when preparing for fundamentals of endoscopic surgery. Here's an example of one of our call rooms that's available when on call overnight at the hospital. Individual call rooms are available to all residents, from interns all the way up to chief residents. We're happy to have had some recent new construction around the surgical ICU, as well as the operating rooms, which has provided us with a new surgical ICU workroom, as well as some classrooms around the operating rooms. Renovation projects are ongoing currently for the operating rooms, with plans for completion over the next several months. Finally, I'd like to touch on the different dining options that are available around the hospital. We have a large cafeteria that's open for breakfast, lunch, and dinner, in addition to a cafe that has more specialty food items open for breakfast and lunch. We also have a coffee shop that's open during the day and provides late night food options when on call. Pictured here is the hospital courtyard, which is a favorite spot among residents to come out and eat lunch or spend some time outside when the weather is nice. I hope this video has given you some insight into the different services that we spend our time on during residency here at Ascension St. John Hospital, and given you a brief virtual tour of some of the facilities as well. Please do not hesitate to reach out to us with any questions you might have during your application process. Thank you.